Did you know that 75% of people with hepatitis C are unaware that they have the disease? What we're going to be talking about today is what is hepatitis C, who's at risk for it, and can we be treated for it? All right, so hepatitis C is a slow processing disease, and it can lead to cirrhosis of the liver, liver failure, liver cancer, and liver disease. What's the next one? So who's at risk for Hep C? It says about 3.5 million people in the U.S. have it. Now, with that being said, the baby boomers are more at risk for it. So who are the baby boomers? The people who have been born in 1945 to 1965 are more at risk for it. All because when they do we just started in 1992 doing the blood screening, the test for different types of diseases like HIV and other diseases. So more people were more at risk for it because back then they just was receiving the blood and sometimes it was contaminated and didn't know. Also, you can get hepatitis C from using dirty needles from others that like using drugs. And then also sexually transmitted when you have multiple partners and sleeping with both men and women, things of that nature as well. Also, you're more at risk when you go get the body tattoos and body piercings. If you don't see that they're a sterile instruments, then it could be contaminated, and you more at risk for having hepatitis C. Now, with that being said, also with pregnant women, they can actually pass that to their newborn as well if they have the Hep C in their body. CDC, I'm quoting Dr. Tom Frieden. It says many people who test positive on the initial hepatitis C test are not receiving the necessary follow-up tests to know if their body has cleared the virus or if they are still infected. Complete testing is critical to ensure that those who are infected receive the care and treatment for hepatitis C they need in order to prevent the liver cancer and other serious and potential daily health consequences. A lot of people find out that they have hepatitis C, and once they get that first treatment, they're like, oh, okay, well, I'm cured, and that's not it. So, can hepatitis C be treated? Yes, it can be treated. And just recently, we have a cure for it. So, with that being said, you have a 3-month treatment, and you have like Harvoni, and this is a couple other drugs that they use together for a 3-month treatment of it. And with that being said, there are side effects to it. You get anxiety, dry mouth, excessive fatigue, headaches, mood changes, weight loss, and just recently, as far as in my clinic, working in infectious disease, when we do get our patients to come in, they most of the time do have a lot of mood changes because it's like a hard acting medication. It's basically kind of tearing you down to kill that disease. So you see a whole lot of depression with it, and sometimes anemia as well. So in conclusion, we talked about what is hepatitis C and who's at risk for it, which was the baby boomers, and drug users that uses like dirty needles and multiple sex partners, and using non-sterile instruments when they do body piercing and tattoos. So with that being said, if you are a baby boomer or you feel like you are in one of those categories, know your status. Because if you don't know your status, if you don't know your status, then how would you know? Like I said, it is a slow processing disease, and you won't know. It stays in your body, and when you finally find out that you have it, it probably can lead to liver disease, cirrhosis of the liver. So it's good to know your status. Get tested.